Are there any other medical conditions of the eye that you might treat that bother people?
We all think of like pink eye and conjunctivitis as a big problem.
Yeah.
Certainly as you get to the winter months, it certainly can be. There's a lot of that going around, especially in the wintertime, because the most common form of pink eye actually is viral conjunctivitis. So the same respiratory viruses that transmit the common cold can often affect the eyes and make them red and inflamed and irritated. And unfortunately, they're usually pretty contagious too. And so definitely in the winter months, they tend to act up more.
Is pink eye usually one side or is it both sides? Is there anything like kind of rule of thumb?
Yeah, so that's actually a good differentiator. If it affects both sides, almost always it's viral. Or allergic conjunctivitis is a thing too. But if it's bacterial, usually it will affect one eye. It will usually be more crusty, gooey, all the nasty things you think about with pink eye. You can have some crusting with viral too, but it tends to be a little more clear, not as extreme as you would get with a bacterial. But bacterial is much more common in kids.
And they would require different treatments.
Exactly.
So we shouldn't probably, unless we can avoid it, not self-diagnose.
Of course, yeah.
Those things. Now, I've been seeing some things on TV.
About the eye drops, is that
eye drops that make the whites of your eyes whiter? That's what I think I'm seeing. I mean, how bad does it have to be that you're going to put drops in your eyes to make them whiter? And what damage can that be doing? There's like an icky factor. It's like, why are you putting something? I assume that constricts blood vessels.
It does.
Tell me, what are these products? What are they doing here?
I would say traditionally, that is a class of medications that I try to avoid. So things like Visine or Clear Eyes, they work by constricting the blood vessels. They usually have an antihistamine in there as well. But the problem with those is they tend to irritate the eye as well, so it can make them a little more red once it wears off. And you get this rebound effect. So the blood vessel constriction happens, your eyes look nice and white, and then about 2-3 hours later, you actually get some dilation of that blood vessel, and now they look more red than before.
Worse.
So people often fall into the trap of using Visine real frequently, 4 or 5 times a day, because after a few hours, it wears off and their eyes look more red, so they put more Visine in. So most ophthalmologists would tell you we don't really care for Visine or Clear Eyes, the ones that specifically are marketed for that. Now, there is a new medicine, or relatively new, and maybe this is what you've seen recently.
These ads are not cheap, Adam.
Yeah, I know. Called Lumify, and that one's
that's it. What is Lumify?
So it's actually a very dilute glaucoma medicine. So brimonidine, the active ingredient in it, is what we've used to treat glaucoma actually for many, many years. But they found that in low concentrations, it helps reduce redness. And so if you're going to use one of the redness-reducing eye drops, that would be the one I would personally prefer. But
so it's not first of all, so they market it because the safety measures have already been done.
Yes, exactly.
So it's just now, is that going to cause chronic problems? You want a white eye for a photo shoot, or you've got a job interview or a date? I mean, whatever it is that's making. And the ads are just for women. It was just women on there. So you don't see any problem using it, at least from time to time?
Not from time to time. Again, anything in moderation is fine. If you're feeling the need to use it multiple times a day, then that's where it really becomes a big problem. The one thing that brimonidine, the active ingredient in that, has been shown that in the high concentrations we use for glaucoma treatment, it actually can, in the long run, cause an allergy to the surface of the eye and more irritation. They found in the study, and they did some other glaucoma medicines that had the lower concentration, and the rates of that were much, much lower. And so Lumify has not been out long enough to really know if that's a risk of long-term use, but we know that medicine does sometimes cause some chronic irritation if you're using it frequently. And, The glaucoma patients that are on it are often using a high dose of that, like a 10 times concentration of that twice a day. And they've used it for many, many years without problem. It's got good safety profile from that standpoint. The biggest downside is that you can get some chronic irritation from it that would go away if you stop it.
Well, that's reassuring. That's
Yeah.
good to know. That's good to know.